Hello, everyone, and welcome. Today, I am joined by Sister Fiona Booysen, who is one of our registered nurses on our network. Sister Fiona, thank you so much for joining me today, and you are most welcome.
Thank you kindly for having me on.
It's a pleasure, Sister. Sister, let's start from the beginning. If you can tell us a bit about your journey into nursing and also what led you into home-based care.
I'm nursing now for a total of 36 years. I started in the lowest possible category. I started as a nursing assistant. I then studied and
Mm,
became a staff nurse. I then bridged and became a registered nurse. I then did a few post basics in nephrology, and then I became a unit manager. And I just
mm,
loved nursing. The home based care was towards 5 years ago. I realized that patients in their home need to feel safe, secure.
mm,
And when the
mm,
families leave them, they need to know that whoever they're leaving their family with is going to be kind and compassionate. They don't have to worry at work that their elderly families or their sick family is going to be ill treated. And that is the
mm,
reason that we actually started Fair Nursing with the view of knowing that in the patient's last few months or years, they are treated with the utmost respect and the utmost
mm,
kindness and compassion.
mm. And I really love that answer. And it speaks a lot about you, where your heart is, Sister Fiona. Um, what I also want to just know in terms of starting for nursing, what inspired you to start for fair nursing? For those who are unsure what fair nursing is, it is Sister Fiona's home-based care agency, which is also on our network.
Okay. In 2019, I
Mm,
decided that I'm going to take a sabbatical. I
okay.
left. I stayed at home for about 2 years.
Mm,
Somebody called and said, Fiona, we were told that you have opened up a nursing agency. I actually have registered the company but wasn't operating because COVID. I registered the company in 2019. COVID
okay.
came in 2020, 2021, and then I
Mm,
just left it. Somebody called and a registered nurse called and said, another registered nurse said, you are running a nursing agency. And my immediate
mm,
response was, okay, yes, I am. How can I help? What do you need? She said, I need a carer tomorrow. I said, send me the address, the patient's name, and we will be there tomorrow to assist you. And that's how Fair Nursing, the nursing agency, actually came about. Was a phone call from somebody saying you need a carer, and I said, I can help tomorrow. And that's how we
wow.
came about.
Wow, wow, that's an amazing story. And Sister Fiona, if you would say, is there any misunderstanding that the public has about home-based care? And if so, what is that misunderstanding, more especially in palliative care?
There is a big myth with regard to palliative care. People believe that it's doom and gloom.
Mm,
Patient must go sit there, and us advocating palliative care means we are telling the patient that they must just lie down and die. And that is
mm,
totally, totally wrong. The whole aim of palliative care is so that with curative medicine, we are alongside curative medicine. So the patient can still go for any therapy that they wish, but the palliative care is there to make sure that we are going to assist and work as a
mm,
team with everybody. The patient can still manage symptoms. We can just manage the pain. We can work as a team, manage the symptoms and the pain,
mm,
and be there for the patient collectively as a team.
mm,
So it's
mm,
not
mm,
doom and gloom, and they're not waiting to die. It is an added support system where we are saying we're not judging. We are here for you 24/7. Whatever you need, you can call on us as the palliative care team, and we are here to help you.
mm. And I think this, Sister Fiona, ties well with my next question, which is also my final question. If there's anyone, Sister Fiona, that is watching this, whether it is a patient or one of the family members, or even a healthcare provider, what message would you say, um, or would you want to share about palliative care, and why is it so important that we support our patients when they enter the specific phase in life?
Yeah, I would just tell the patient, uh, you know, sometimes we forget that the family is there and we concentrate on the patient primarily. But
Mm,
when you get to the stage, it is a support team that has to be formed. The patient's
mm,
oncologist, the palliative care doctor, palliative care nurse,
mm,
social worker, counselor, the care partners at any facility, and the family together form a strong support team. So
mm,
we need to tell them that we are here. The doctors can manage the pain, counselor can manage psychological and emotional needs for the
mm,
family as well, because as soon as somebody is told that they have an end stage disease, a family gets so worried and so concerned, and they're sitting there and they don't know what to expect. They're expecting that the patient is just going to die tomorrow. So I advocate that let's live, let's make new memories. Let's not
mm,
sit and wait for death because nobody knows when it's going to come. So as
mm,
a whole, the family and the patient, if they are able to, can really still just make new memories and live. And that's what I advise to them.
mm. Such wise words, sister. Sister, thank you so much for your time, your wisdom, and also sharing with us your journey. We, as Aligned, are truly appreciative of your work that you do for our patients. And once again, thank you.
My pleasure. And you have a lovely weekend.